As in most health centers in Bogota, critical care units at the National University Hospital are close to collapse.
We have 32 beds here, all COVID right now. 15 beds we used in an intermediate unit have now been converted to ICU. We are stretched to the limit.
Dr. Maria OSPINA says the latest surge in infections has been devastating, affecting younger patients and overwhelming already exhausted doctors and nurses.
The most worrisome thing is that we see that the peak is going to last longer than expected. We will lack beds. We are already holding ventilated patients longer in emergency rooms. A month and a half ago, a patient would find an ICU in 2 hours. Now we are looking at a day or longer.
Colombia's third peak of infections has been the most contagious and deadliest, with the average number of daily deaths close to 500. In Bogota, the government says it's planning to transfer patients by air to other cities. Outside this emergency room, relatives of COVID patients fear for their loved ones in need of a ventilator.
It's all full, not only here, everywhere. We are waiting for them to give us an answer, but they are not telling us how she's evolving.
Lockdown fatigue, a growing economic crisis, and a huge population of informal vendors working on the streets have all helped fuel this third peak of infections, with more people disregarding lockdowns and other isolation measures.
Then more than 2 weeks of anti-government protests tackling inequality and police brutality might be making things worse. Authorities warned that the demonstrations were extending the peak. The mayor of Bogota begged people to stick to social distancing rules. Then on Friday she announced she was also infected.
If we don't become serious with taking precautions, I think the collapse will be inevitable, probably in a week.
With the surge now expected to last until the end of the month and no end in sight to the protest, the lack of ICUs might become a deadly reality. Alessandro Rampietti, Al Jazeera, Bogota.